Welcome to Vegas Circle Podcast with your hosts, Paki and Chris. We are people who are passionate about business, success, and culture, and this is our platform to showcase the people in our city who make it happen. On today's podcast, we'll be discussing all things men's health, from prostate checks to kidney stones. We're going to talk the whole nine, man, about men's health, man. So I'm kind of nervous about this interview. I feel like we're talking to my primary care doctor. But let's welcome to the circle, urologist, Dr. David Ludlow. So welcome to the circle, my man.
Thank you. Yeah, thanks for having me.
So let's jump right in, man. So what made you jump into the world of urology?
Great question. I don't think most kids grow up dreaming of becoming a urologist. Most kids don't even know what it is. Initially, obviously, you decide to be a doctor, and I think a lot of people kind of make their decision when they get exposed to different things at medical school. I actually went to medical school thinking I wanted to be a pediatrician.
Okay.
So if you look at my my waiting room now, I went with a very different demographic eventually.
Yeah, 1,000%.
But yeah, for me, I decided pretty early on. I was kind of, an athlete in high school and whatnot, and so I just liked kind of that intensity and using my hands. And so I decided pretty early on I liked surgery. So then it was kind of a matter of, urology. A lot of people don't understand is actually kind of under the umbrella of surgery. And so you kind of just get exposed to different things and talk to a bunch of different mentors. And one thing I wanted is I still like the idea of practicing medicine and kind of diagnosing and having, long-time patients, but I also like to do the procedures and the surgeries and have a reasonable lifestyle. I have a family and hobbies. And so a lot of people said you should try urology, or ENT was another one that I heard that kind of had, checked those boxes. So I actually just did, rotations in both of them. And I had no idea urologists did all the cool stuff they did. I mean, robotic surgery, just a lot of gadgets and toys, scopes, lasers, and I don't know, nothing against ENTs. I got some good ENT friends, but there's a lot of picking, a lot of just like, little microscopes and using your fingers. And I don't know, I just liked the surgeries. And and I also like the urologist. I mean, they're your kind of cohorts, and, they're smart, they're hard workers, but they're also not too high on their,
on the horse,
high horse, got to be a little self-deprecating when you, dedicate your life to the urinary tract. So they're just kind of cool, down-to-earth guys.
Yeah. So you do a wide variety of surgeries, right? Can you kind of give like the whole menu of services or the primary?
Yeah. So it's a good mix. I mean, because we do a lot of clinic stuff, obviously people that have, all sorts of what you think of urology problems or men's health, would come see us. And some of the stuff we can manage with medications and stuff that we do in clinic. And then a lot need surgery. So we kind of, my time is split kind of half and half between the operating room and clinic. So essentially we do all the surgeries for the urinary tract. That's male and female. So we have a lot of female patients, females.
Which I didn't know that. I thought when we were talking on the phone, I didn't realize females.
Yeah. So females get kidney stones, females. I do a lot of cancer because I do a lot of robotic surgery. So do a lot of kidney cancer, and, we do bladder cancer. Obviously, under the umbrella of urology is the male kind of sexual organs, testicles and prostates and things like that, whereas females have gynecologists. So overall, there's more males than females, but definitely see a lot of females too.
Sure. Yep. I'm 45, right? So when should men start getting the prostate exam? Because I hear a wide range of, I hear, 40, 45. I've heard, later in age now, but what from your expertise, what would you say that?
Yeah, you actually look at different guidelines and you'll see, but what you said is kind of in the ballpark.
Okay.
I tell most people 50 years old.
Okay.
There are maybe a couple exceptions. There is a higher risk in African American males. And so, if you are getting routine labs, what I tell, and another risk factor is family history. So if you have some of those risk factors, I don't think it hurts if you're getting labs anyway with a doctor sometime in your mid to late 40s to just say, hey, throw a PSA on there. It's called PSA, which stands for prostate specific antigen. It's a screening lab. And I tell them, hey, if you get it checked at 45 and it's really low, then don't worry about it. And then just start getting kind of annual screening when you're 50.
Yeah.
But if you don't have any real risk factors, I think 50 is a good time to start.
This is probably a stupid question. Why are so many prostate cancer cases?
It's, essentially the most common cancer in men. That's a good question. I mean, there's a lot of research going on. obviously with age, it's, aging men. I mean, there's been some data showing that if you did autopsy studies on men in like their 80s, like 50% would have some prostate cancer cells. Now, obviously, the good majority of them aren't dying of prostate cancer.
Mm-hmm.
So that's one of the balancing acts is, we're not just looking to diagnose prostate cancer. We're looking to diagnose clinically significant prostate cancer that would maybe actually cause that person problems. That's why if you looked at the screening guidelines, you also don't see them talking about screening people in their 80s because it's kind of a weird way to look at it. They got competing factors. They got other, issues going on at that point. But yeah, I mean, as far as causes, I mean, I mentioned the risk factors with African Americans.
Yep.
One thing that's interesting about that is if you look at Africans, like in Africa, they actually have a relatively low risk of prostate cancer.
Is that the diet?
But African Americans, we don't know, but that's what I think.
Yeah,
I think it's the Western diet. All the processed food. I mean, you look at the food and all the ingredients. I mean, it's so hard to study, like all these different words that you can't even pronounce when you look at the ingredients. But, you got to assume that over time, some of them might take its toll. So it's definitely a hot area of research. Mm-hmm. Every once in a while, they'll find something that they think has a link. And then as they do more data, they're like, maybe not. So it's still to be determined.
Let's talk about vasectomies, right? So I've got 2 kids up later in age. I'm scared of, is it that crazy?
Well, I sometimes tell patients this. I should create a T-shirt that says that wasn't as bad as I thought it was going to be, and give it to people after the vasectomies.
Okay.
That's usually what they say. Now you know how guys are; they like to milk things.
I've been milking it,
and they're
for
going to
longest.
scare their friends, and then you get it done, and they're like, "Yeah, see, I told you it wasn't that bad."
Yeah.
But now why you should get it? I mean, really, at the end of the day, it's probably, assuming you're married or in a relationship, it's if obviously both of you have made the decision you don't have any more kids. I mean, it's kind of a nice thing to do for your wife. I mean, it's it's so much less invasive than to get your for the females to get their tubes tied. That's like a legit surgery under anesthesia. And plus possible side effects from IUDs and birth control pills. On the flip side, it's a 10 to 15 minute clinic procedure.
Is it that fast?
Yeah.
So are you knocked out for this surgery, or is
not,
you literally
not in general.
up it?
Yeah, I mean, you can be, per request. In my clinic, we have something called Pronox, which is this kind of happy gas.
Did you say pro nuts?
No.
I was like, I know he didn't say that.
I should market that.
Yeah, Jesus Christ. We could market it together.
Pronox.
Pronox,
It just takes the edge off. It doesn't put you to sleep, but it, kind of relaxes you a little bit. And then we use lidocaine. I kind of compare it to getting a cavity filled. Obviously, very different part of your body, but I don't know if you've had a cavity filled, but there's kind of that like sting from the lidocaine, that gets your attention. But then after that, it's like, oh man, I don't even really feel anything. That's crazy. It's the same idea. You got to inject some lidocaine down there, and that can sting a little bit. But most of the time after that, I got some Pandora music in the background. We're shooting the breeze, and usually they're like, well, that's it, we're done. Yeah. And, then you just got to take it easy for a couple days afterwards.
Is there a lot of side effects from going, because I'm be honest, like you're scared in that area, right? Where you think that, just being blunt, I mean, you can't get it up anymore, period. Does that happen? Do you see a lot of those percentages of people once they get the vasectomy that, hey, they're going to have problems down the road?
That's
what I'm scared.
Side effects, long term.
Yes,
you know what? There is like really no chance of getting erectile dysfunction.
That's what you hear.
I mean, where you're working at is so far away from the nerves that deal with that.
Okay.
There's
that's the horror stories you hear all the time.
And even though the testicle is responsible for producing testosterone, it's not going to have any effect on your testosterone.
Okay.
To be honest, I don't know what kind of words we can use on this podcast.
You can use whatever you want.
Your ejaculate. There you go. That's probably not a word that's brought up a lot on your podcast.
Not at all. Yeah.
You won't even really notice a drop off in your ejaculation. I mean, a lot of people, they just don't understand. They think that nothing's going to come out, after you have a vasectomy. And really, you won't even notice a difference in the sensation and the erections, except you just won't have any sperm in it.
That's clear. Okay. As far as kidney stones, do you have to perform a lot of surgeries on kidney stones, or is that something that just has to pass?
You can ask your wife.
She works with you.
She's in the operating room, and I'd say from a volume standpoint, that's the most common
You see a lot.
surgery. I mean, there's different types of surgeries depending on the size and location of the stone, but as far as like percentage of my surgery cases, I'd say I got to assume it's easily kidney stones. So luckily the majority of people can pass their kidney stones, but there's a lot of people that can't or they don't want to, so we preemptively treat them. So yeah, that's a very common surgery we do.
Is there anything we can do to make it better for ourselves to not have these problems as far as kidney stones?
Absolutely. I mean, obviously it can be multifactorial. I mean, there's some people that could do everything right and there's some kind of predispositions they have, but absolutely the diet has a huge influence. That's why I'm always going to be in business. I mean, it's energy drinks, it's processed foods, it's, if you do things that increase your uric acid, like a lot of meat, especially red meat, just essentially what people are eating every day, and especially in Vegas, people, it's a desert.
Yep.
And so people get dehydrated. And what a lot of people don't understand is a lot of the fluids that they're just in the habit of consuming do not actually hydrate you. In fact, a lot of them dehydrate you.
As far as what? Yep.
Specifically caffeine,
Okay.
caffeinated fluids is
Yep.
a big one. And then, a lot of these sodas and other types of drinks, even if they don't have caffeine, they're kind of a wash. They don't necessarily hydrate you, even if they don't necessarily dehydrate you. But caffeine definitely acts like a diuretic. People think like, well, I'm peeing more. That means I must be really well hydrated. But really, it's the fluid's not going into your body the way it should. It's just coming on out. So you get people that drink coffee in the morning, and then they have a Diet Coke with lunch, and then they have a Red Bull to get them through the afternoon, and then they think they're drinking a lot of water, but then they look back and they're like, I really, I still have that same Stanley that's they've been there all day, and it's only been 1/3 of it's gone. So that's that. That number one, my patients always ask if it's their first time stone. I harp on, cut back on stuff that dehydrates you, or if you really, really want that Diet Coke, you got to just realize, okay, I got to drink even more water to kind of counteract the effects of it. And then, it's, other just general health things, trying to eat relatively clean and avoid things that are high in sodium. A lot of people hear stones are made of calcium, so they think they got to cut back on milk and cheese, but that's actually hasn't really been proven to have that. It's more sodium, so that's sodium, more processed food, packaged food,
salt
stuff
and crap.
like
that adds up.
Sometimes I feel hypocritical telling because I could do better. But
So I feel like I'm beating a dead horse with this prostate, right? But porn is big, right? Do you have to deal with a lot of that where you're seeing that porn specifically is having an impact on men in general, as far as with their prostate and things along those lines?
That was an interesting transition.
Yeah, I know. Set you up.
The prostate to the porn.
Set you up.
Just the classic, prostate porn transition. Well, that's interesting you say that.
Yeah.
I think it can have. Well, I mean, listen, I'm a religious guy. I think it can have a lot of effects emotionally and with relationships and stuff like that. But it can have some physical effects as well. As far as performance, as far as erectile dysfunction, it's interesting. So I had this patient that came in not too long ago, and I don't know. I don't know if it's said from the note from the primary care doctor or if it was just on the chief complaint, but it was something to the effect of like difficulty ejaculating or not having much ejaculation come out. And I was with my partner, Craig Hunter, who's another urologist, good friend of mine, that we share a clinic together. And, I'm like, man, what do you do with these guys? Because it's not like I can give them like a medication there's not a procedure. And so he's like, well, I ask them, if they masturbate, and that's maybe more correlated with porn than the prostate. So, I'm making that connection. But,
and that's what I was getting at too. Yeah, for sure. Yeah.
And or not maybe not even masturbating, but just ejaculating. And he said, ask them if they ejaculate or masturbate multiple times a month, multiple times a week, or multiple times a day.
It's a big difference. Yeah.
And he's like, I can guarantee it's multiple times a day. And so I worded it the exact same way that he did. And sure enough, the guy's like multiple times a day.
And he had prostate cancer? Or?
No.
Okay,
This was
Jesus,
this was just the ejaculatory, just like complaints, like pain with ejaculation. He's a young guy. Sometimes he's having difficulty with erections or difficult with ejaculations. And so I don't know if this is the right way to say it, but maybe there is too much of a good thing sometimes, So, and then another thing with pornography is I think it can have an effect on erectile dysfunction. I'm not a sexual therapist, but sometimes, the patients treat us like we are. So they, sometimes open up to us even more than we're trying to get them to. But a lot of patients, especially if they're younger. So I think this is right in line with what you're saying. I'm not having a lot of 70, 80-year-olds, I think, that are dealing with this. But when I have a 30-year-old, even a 40-year-old that's talking about erectile dysfunction.
That's ridiculous,
Or, some of these like ejaculatory stuff. If I can get them to be honest with me, one thing I ask them is if you were not with your partner, so say they're married, a lot of these people are married. Are you able to get an erection? And then if you are with your partner, you're having difficulty. And a lot of times they'll say, it's difficulty with their partners. And I think it's because their mind is so stimulated with this pornography and, kind of what their expectations are or whatever it is, that all of a sudden when they're, with a partner or, especially if they're in a relationship, they have a hard time, and that can be very debilitating. So they just want Viagra and stuff like that, but that's just definitely throwing a Band-Aid at it. So I think it is definitely an epidemic, I guess you could say.
Yeah, because everything's at our fingertips. That's the thing that's so crazy, man. It's way too easy, man. Yeah. It's crazy. I know you have girls also. My wife and I, we have 2 boys, and we block them from their phones during the week, and then they are able to start just they get a break. But I feel like as adults, we probably need to get blocked from our phones, during the week.
It's not magazines or the slow dial-up internet anymore.
Yeah, it's everything, anything you want.
It's way too easy.
Yeah.
I'm glad I'm not a kid right now. That's some of the temptations and stuff that they have to deal with. It's tough, but I think definitely a lot of these habits, whatever you want to call them, addictions, they can definitely start at a young age. So I think, having... Man, we're kind of going wide
deep
here.
Yeah,
but,
we're going deep. I get it. I get it. Yeah.
But having that relationship with your kids that you can talk to them and let them know that you love them, and that's why you're not letting them have access to some of these things because, you start those habits young and, you see it a lot. And
it unravels quick.
Relationships, newlyweds, and, they have problems, and so, it's, I think along with the urology issues involved, it can definitely have a lot of repercussions for sure.
Do you find any diet that can help you with any of these things that, erectile dysfunction, prostate, things like that? Anything that you've seen that's been helpful for men?
Yeah. I mean, there is some data on that. And again, kind of similar to the kidney stones, eating clean can help. There are certain kind of supplements or foods that can help with maybe helping with your natural testosterone and kind of blood flow and stuff like that. I mean, diet and exercise is huge. Just like you hear about people who, oh man, I lost 40 pounds and I got off my diabetes medications or I got off my blood pressure medications. People don't realize it can have an effect on your GI system, how regular are there. It can definitely have an effect on your urinary system, urinary symptoms, erections, all that stuff. Just having a good, healthy diet, exercising, avoiding obesity, avoiding diabetes. Diabetes can wreak a lot of havoc with the, men's health. Erectile dysfunction, kind of just urinary complaints. It can definitely.
It's crazy how it's all connected. Yeah. Especially stress. I mean, you overweight, stress and everything kick your behind. Yeah.
Yeah. Stress. Yeah. That's another thing that's crazy. Emotional stress can have an effect on. I mean, a lot of people I think have had that sensation when they're really anxious about something, and you kind of get that call it
Something
the
you
pit
got.
in the stomach, but you
Yes,
just,
yes.
you lose your appetite
Yes,
and
yep.
stuff like that. I mean, that's kind of crazy if you think about it. Like what does your gut have to do with you being, you know, anxious to go on a podcast or whatever,
Yep.
My gut felt fine. You made
No,
me
that's
feel
good. I
very
was going to say,
at
they
ease.
set
So,
me
but
up.
yeah,
Set me up.
just,
Yeah. Yeah.
but it can also have an effect on urinary stuff as well. I mean, there's actually a couple actual urinary syndromes where people can have really painful, bladder or pelvis area kind of symptoms, and it's crazy. It can have a direct correlation with actual just stress.
That's wild.
Yeah.
The human body is the most amazing thing in the world, man.
Yeah, it's all intertwined,
Yeah, that's amazing. Andrew Schultz. I don't know if you know about Andrew Schultz. He just had a Netflix special. And he was talking about infertility, which I thought was really interesting, that he was open about. And you would think, men, we always blame it on the women, but a lot of the times it could be the men, right? Do you have that? Did you have to treat a lot of men with infertility challenges?
Yeah,
things like that?
I think
I didn't realize how, it's common. I didn't
I think
realize
it
it was that
definitely
common.
is underdiagnosed.
Okay,
Yeah, I agree with you. A lot of people
Mm-hmm.
just always assume it's the female, and I think.
And just to cut you off for one second, the only reason why I brought up Andrew Schultz was because he's popular, right? So he's bringing attention on something that I don't think is discussed enough, and it caught my attention. Where I'm like, wow, okay, I didn't even think that the infertility for men was a big thing. So that's the reason why I was asking you about it.
Yeah,
So,
yeah, for sure. I mean, I don't remember the exact data, but I think about 1/3 of the time, if a couple's having infertility problems,
issues,
it's a male issue, which I mean that's significant.
Yes,
because I think a lot of people assume it's probably much less than that.
Yes, yeah.
Yeah, so I mean, I think it's important if you're dealing with infertility. I mean, these quote unquote infertility specialists that do IVF, in general, they are under the umbrella of like OBGYN, like they do an OBGYN residency. So backtracking, this is probably a review for most people, but you get your undergraduate degree and then you decide to go to medical school, and then it's during your medical school that you decide on what specialty to do, and then you have to do a residency in that specialty. So urology's is a specialty that you do a residency in. OBGYN's a different one. And then you can even go beyond your regular residency training, do fellowship training in, specific fields within that specialty. So most of these infertility doctors went through an OBGYN residency and then did a fellowship in infertility. And so they spent their whole career dealing with females. And so even when you go see them, a lot of times their focus is on the females. And so, they're doing all these tests, and some of them are kind of like somewhat invasive tests when I think sometimes the men are just kind of waiting and blaming it on their wives. But they should get tested too. And I don't mean to say that there are actually some really good infertility doctors in town that do actually test the men, or at least encourage them to get tested as well. But yeah, it's they probably should be tested more.
For sure. Yeah. Technology is getting amazing. I can't even imagine where we're going to be 10 or even 5 years from now, man. So I heard you talk about like robotics, right? Like you're using a robot when you're when you're doing your surgeries, correct?
It depends on the surgery.
So how does that work? Is it you're doing? Does the robot doing everything, and you're typing it? Like what does that look like? And I'm probably asking a dumb question.
I wish. And it's great. It's a great question because we throw this term robotic surgery around a lot of times, and I sometimes have to like.
I think it's like an AI.
Well, I got to tell the patients like, listen. Sometimes I don't love that name because you think robotic surgery, you think it's doing the surgery, and I'm taking a coffee break, but yeah. Just on the subject of technology, by the way, to shout out to urology. I feel like urology in the last 20, 30 years, the advancements it's made is crazy.
Yeah,
the stuff that we can do, minimally invasive. What's crazy is imagine like 100 years ago, if you had a kidney stone that was obstructed in your ureter, severe pain. Like they don't have ways to do a CT scan to diagnose it. You're just
dealing with the pain.
And then,
with it.
If someone needed to get their stone treated, I mean, you have to like do an open surgery. You'd have to like make an incision in their abdomen, go in there, figure out what's going on, like make a hole in your ureter, pull out the stone. Like that's a crazy big surgery. And, as Daryl, your wife, can say, I mean, usually these ureteral stones, they probably take me, 20 minutes.
Wow, you in and out.
I go in with the scope. I use a laser, break it up, remove it, outpatient surgery.
And they're done
after a
the same
couple
day.
days. They're back to doing whatever they want to do. So, we call it minimally invasive surgery. The things that we can do as urologists and a lot of other fields, it's amazing as well.
Mm-hmm.
But yeah, so to get back to your question, robotic surgery is a type of laparoscopic surgery. So,
Okay.
A lot of people have heard that term, and, they always, either they've had or know someone that's had their appendix or their gallbladder removed
Mm-hmm.
out, and they know it's through a few small incisions.
Mm-hmm.
And so traditional, we call it laparoscopic surgery. You have these few little keyhole ports, and you can put instruments in it. One of them is going to be the camera.
Mm-hmm.
And traditionally, it's usually an assistant that's holding the camera, and then you have two arms, and all you can do, they're like poles with either scissors or graspers or something at the end, and all you can do is open and close them and kind of move them up and down like this.
Interesting. Yeah.
And that still works if you're working in a space that doesn't require a lot of intricate suturing,
Okay.
or it's not some weird tight space. But robotic surgery really took off with urology because some of the cancers we deal with, it's right up that wheelhouse. For instance, prostate cancer. So almost the standard of care now. You might find an occasional, old school urologist like my partner Joe Candela that does it open.
Okay. Yeah.
But in general, you do it robotic, and it's really nice in the prostate because that's deep in the pelvis. Your pelvis is this. If you were to see an anatomy chart, it's this big bony structure, and it's deep in it. If you do traditional laparoscopic surgery, you're actually just clanging on those bones. You can't do it. You don't have much movement. But it allows you to work in a tight space, and it has joints. And so I'm actually in a console. It's almost like playing a video game. I tell people sometimes, like, I'm in scrubs.
You talking
like
Chris's language if Chris was here. Yeah.
Well, I mean, this new generation of kids, they're used to you looking at a screen and doing stuff. It's hard actually for people that didn't grow up with video games and TVs and stuff as much to pick up on it because they're not used to looking at a screen and being able to like conceptualize that they're working on it. But I have this console that allows me to see what's in the body with the camera, like 3D, and then I actually have the ability to have a few different arms, so I can retract with one, and I'm doing it the same motion like I'm using my hands. So if I'm in the pelvis and I'm sewing something, I'm doing like this, but I'm using the joints on this instrument, and I can retract with one arm, and then I have gear like clutches, so I can move my camera around. I can clutch to this arm, and then if I need to adjust my retraction, I can clutch back to this arm. And then I do a lot of kidney surgeries for kidney cancer as well. One of them is a partial nephrectomy. Nephrectomy means removal of a kidney. Partial means you're not removing the whole kidney, you're just removing the tumor. And there's a lot of sewing, as you can imagine. If you're putting a hole in the kidney, you got to do a lot of sewing to sew it back up and sew it well. And if you were to do traditional laparoscopic surgery, like, kudos to the guys that could sew well with it, but it was cumbersome as heck. Like,
Can't even imagine. Very tedious.
To just be able to, like, do this but here, like, I'm able to do all this sewing, and it's cool technology.
Yeah.
And now you see it, like, urology really is the first field that really took off with it. And then gynecologists, because they're the same thing with the pelvis, doing like hysterectomies. But now, I mean, they're doing brain surgery, orthopedics are using it. Like, it's just because of how delicate and fine the movements are, it's really taken off.
That's amazing. Yeah. As far as, just advice, right, in general, just business advice and even education advice. Maybe they want to do an internship is one way to be able to do it. That's something I did at Tufts Medical in Boston, is took a 3-year internship to really see if I wanted to get in medical.
Oh, that's cool.
But what would you recommend for somebody that maybe they want to get into the field? Because there's a side of being in medicine where it's a business too, right? If you have a small practice and things along those lines. But what would you recommend to them as far as business or school?
I definitely think exposure is good. I mean, it sounds like you were interested in it, and maybe the exposure kind of showed you that, maybe this isn't for me, and that's good that you figured that out early. So I think exposure, and, so we use the term shadowing, or, for me, so I did not come from a medical family. I was not exposed to it much. It wasn't until I met and fell in love with my beautiful wife, shout out Casey, that she has a medical family.
Okay.
And she was a nurse. So she was actually sugar mama for many years.
There you
as
go.
I
Yeah,
was
sound
going
like me.
through
Yeah.
undergrad and
Yeah.
medical school and stuff. She's you know, an RN, and her dad was a family practice doctor. You know, her sister's an RN. Another one is occupational therapist. Her brothers at that time, one was like a surgical sales rep. One was a pharmacy
everybody's
rep. So they're all
whole-
doing
yep,
something
yep.
medical. Where my family's like just a bunch of teachers.
Yep.
But I was interested by it, and you know, kind of started down that pathway. You know, and her dad was a good mentor because, you know, he's a doctor, and I had a lot of friends whose dads were doctors, so I kind of talked to them. But I think what you said is huge, getting some exposure with it.
Mm-hmm.
So when I first started thinking about it, I actually got a job, and this is while I was an undergrad at BYU, as a pediatric CNA, a home health aide.
Oh, wow.
So I went around
got thrown into it.
and
Yep.
worked with these kids that had like muscular dystrophy and cerebral palsy.
Oh, yeah.
And I wasn't even doing like hardcore medical stuff. I was like getting them ready for school and like putting them in their wheelchair, but just being around patients,
Mm-hmm.
being around families, learning about, you know, the diseases, getting the satisfaction of helping them.
Mm-hmm.
And as I told you before, I went to medical school thinking I wanted to be a pediatrician
Okay. Yep.
because of that, you know, and obviously I changed my mind along the way, but at least I had kind of been around healthcare. I even worked in like a nursing home for a while.
Oh, wow. Yeah,
My
that'll
wife
change your
was
perspective
like,
too.
My
Yeah.
wife was like my boss. She was the nurse and I was the lowly, you know, CNA. She was tough. She ordered me around. And, but you just to have that exposure. But yeah, it's a tough road.
It is.
Man.
Yeah,
It's,
very much so. Yeah.
I mean, you got to definitely. Let me put it this way: if I realized how big of a road it was, like if I had to go back and start over, I'm like, I don't know if I could do this again. You know, luckily I was kind of naive. You know, but you know, I served a church mission in Taiwan, so I learned Mandarin Chinese. So I came back from my mission thinking like maybe I'll do something with business. Took, you know, business classes,
You know what fluent?
economy.
You know Taiwanese?
I guess you could say I'm fluent. I mean, that
That's
was
awesome.
25 years ago.
That's
So
awesome.
it's choppy now.
Yeah.
I'd kind of have to be leading the conversation, but you know.
That's amazing.
And do you know what? Actually, those classes came relatively easy. I was doing well, and I was getting A's. And then, but I just, for me, whatever I wasn't feeling stimulated or satisfied by it, and I was kind of guided into trying medicine. So then I started taking the pre-med classes. That was humbling. Those were not easy, you know. And some of them, they make them tough. I mean, they're trying to weed you out, you know. And all of a sudden, you know, it's just cutthroat and like. You know, the average in the class is a B-. No one wants to like.
Oh wow!
See,
So you're
you know,
average.
like
Yeah.
it was just tough, and you know, but persevered. But every step of it's tough. I mean, it's competitive to get into med school, so you got to really want it. You know, be dedicated. And I was really blessed to be able to get in probably my first choice, which was University of Utah, which. Even though I'm not a Ute fan, you know, it was in state and it was close by and it was a great program. And you know, but that was stressful. You know, I had a lot of that gut discomfort that we're talking about as I was going through that process. You know, and then medical school's a grind. But man, once you get into med school, it's a little different. You're kind of you know you're going to be a doctor there. It's kind of like
you put a lot of time in,
down,
man.
but
That's
it's
a lot of time.
It's a lot of tests, and so then it becomes like. If you want to do something competitive, and a lot of people won't know this, but urology is actually a really competitive field. You know, it's a surgery field. It's got a better lifestyle, things like that. And so I had to like do well on my tests, and I had to go. You just got to put yourself out there. I mean, it's kind of like that. I mean, if you want to be an athlete, you got to be putting in more time than the person next to you, and that's kind of how I felt. I'm like, you know. I wasn't the smartest person in my class, you know, so I'm like, I'm going to go do some away rotations. I went to these programs in Texas and Illinois, and I'm like, I'm going to get there before everybody else. I'm going to, you know, whatever, and I'm just going to like treat everything like it's a job interview and, you know, get letters from these department chairs. And, you know, I wasn't sure I was going to get into BYU, but I grinded, I did. I wasn't sure I was going to get into medical school, but I grinded, I did. I definitely was, you know, never comfortable that I was going to for sure get a urology residency, but it worked out for me. But you definitely you got to be committed. But yeah, get that exposure, and but it helps if you're smart and a good test taker, but you can, just kind of like you see these athletes that, they might not be as natural, but they can grind.
Persevere,
and I feel like I was a grinder and got into the Ohio State University, and that's where I did my residency, and it happened to be kind of a robotic surgery mecca. So we did a lot of
Ohio State
surgery.
I didn't know that.
Yeah.
Okay.
And so, some of the most high volume, big names, were faculty there in robotic surgery there.
Awesome.
And so things worked out for me, but that was kind of a long answer. But
Yeah, but I get it though. Yeah, it's
but
good
if you want
persevere.
it, I'd encourage it. I mean, it's great to have a career that is stimulating. It's tough. I was on call, this last weekend, and I had to go do a couple surgeries at UMC in the middle of the night.
Oh wow.
Sunday night, and so I didn't wait. I was awake at 1 a.m. and then I had to go straight to clinic, and I was all day in clinic. And so I mean, and this is one of the easier surgery fields as far as call and lifestyle schedule. So it's definitely not easy, but it's nice to have a career where you feel like you're hopefully helping people, and still getting compensated okay, and but it's
That's awesome.
you just gotta like
keep
you
going.
like I could tell you're a grinder. You
have to be.
You're
Man. You
one
have
of the
to
most
be.
successful podcasts
Thank you.
in
Thank
Las
you very much.
Vegas, and
Thank
I'm
you.
sure it's because a lot of times you outwork the other people.
It's consistent.
Doesn't
like
help
we
you
were
have
talking about
that silky smooth voice.
earlier.
So
Oh, appreciate
that helps,
it, man.
but
Appreciate it. No, that's good, man. You brought up a lot of great points, man. As far as like maybe if you rethought about it and restructure your life, maybe you wouldn't do it. But the thing is, you persevered, and that's what I got out of that is outworking everybody.
I'm happy I did it. I'm just saying it's a long road. Yeah, you got to be committed.
Imagine.
I mean, look at it this way: 4 years of undergrad, 4 years of medical school, 5 years. The residencies they change. They're usually anywhere from 3 to 5. Some are even 6 years if you do some research and stuff.
Yeah.
Plus, I did a 2-year church mission. I mean,
So
I
you
was
added on to that. So you was like 15, 16 years.
I was like almost into my mid-30s before I was making money. That's why it's lucky I had a sugar mama.
Like being a nurse, yeah. And you guys have 4 kids,
it's a long
right?
road. So I mean, I had friends that were buying houses and doing all these stuff and had their businesses, and I'm still racking up debt. Yeah.
That's amazing.
Yeah, we got 4 daughters.
I did want to ask you about just a little bit of just one question about family. What is it like being a girl dad, man? Because you have 4 girls, right? What's your household like, man? Dealing with basically 5, include your wife. Yeah.
It's man, I don't always understand the drama. I'll tell you that.
Chris, if he was here, he'd be able to speak. He has 3 girls, so
they, sometimes they'll cry on the first day of school. They'll cry on the last day of school. I don't get it.
Yeah.
Sometimes.
What's their ages? Yeah. What?
They're all about 3 years apart. Right now, I got one in elementary school, Roxy, who's 9. I got one in middle school, who just got the principal award of the year.
Congratulations.
Shout out Kate. And then she's 13. I got one that just turned 16.
Oh, wow. Yep.
Nora, she's at Palo Verde High School, Miss Extracurricular Everything.
Yeah.
Just broke up with her boyfriend and realizing that single life sometimes has more drama than being in a relationship.
Yeah.
And then my oldest, Lucy, she's 18, and she's actually in cosmetology school up in Utah.
Excellent.
So, yeah,
Excellent.
we got them in all.
Yeah, so you're busy life.
Right now.
You got a busy life for sure. Yeah.
Yeah, cute girls though. It's
awesome.
fun. I finally had to go buy 2 male dogs, just so I
to
had
keep the energy right in the
so
house.
my wife went and got them castrated, so I guess they're kind of males. But yeah,
that's hilarious.
I got Snoop and Biggie.
That's hilarious. Yeah, that's really their name, Snoop and
Yeah.
Biggie. Oh, that's hilarious. Yeah. Just changing the subject for a little bit, man. We always ask guests about food, man. So I'm a big foodie. But what's your favorite restaurant in Vegas?
Ooh,
yeah.
My favorite restaurant in Vegas. Maybe some recency bias, but I really like Lotus of Siam.
We've had Penny on, so we know them.
We live right close to Red Rock, and there's a lot of good restaurants in there. Man, we're spoiled.
We are. Shout out to Lou. We know Lou, and we know Penny that
it's
that
crazy.
own that.
Yeah, but the Aria does a good. I like probably two of my top 5 is Javier's, the Mexican restaurant.
Yeah, we were just there. Yeah, actually, us and Chris and his wife. Yeah,
we always go to Newport every year, so we always go to the one there too. And then Din Tai Fung, which is actually from Taiwanese food. So it's a Taiwan. If you haven't been to Din Tai Fung,
I don't think we've been there before.
Oh,
okay. I was gonna say I haven't been there before.
Oh, it's actually I think originally based in Taipei, Taiwan.
Okay.
And it's probably one of the more authentic kind of Taiwanese tasting places. But it's kind of weird. You wouldn't think like a restaurant that just specializes in dumplings would be that good, but
it's good stuff.
It's great for like family style dining. And they just bring out all
You
these
hit my
different
heart.
types
Yeah, I
of
love it.
dumplings and stuff.
We
And
always
it's-
like trying different restaurants. So
yeah,
that's,
if you
that's
haven't
good.
been there,
Okay.
I strongly recommend it.
Awesome.
Yeah.
So you mentioned Lotus of Siam, Javier's, and Dim Tai Fung.
Yep.
Okay. Excellent, man. What would you want to leave us out on? Any question I forgot to ask you that you would want to leave us out on? I know we went on a wild goose chase with different rabbit holes, but
I'm just trying to think of men's health. I mean, a lot of people are interested in low testosterone. You know, we didn't really jump into
touch
that.
on that. Yeah.
I will say this. This will be my one piece of advice with testosterone is I think a lot of people like the idea of being on testosterone and wanting to have more testosterone. But my advice is, you know, do whatever you can naturally, you know, eat right, exercise, you know, and, you know, there's natural ways, you know, to boost your testosterone. I've seen a lot of people that however, they're able to get their hands on actual prescriptions for testosterone. And the thing they don't realize is after a while, if you're taking testosterone, your own factory's shut down. You know, they're saying, well, I don't need to make it. I'm getting it, you know. So, you know, kind of like a lot of like muscles or whatever, if you're not using it, they're going to atrophy. Your factories that produce testosterone, they're not going to work as well. So you get these guys in their 20s and 30s that just want to like bulk up for the ladies a little bit. And they, I don't know if they're convincing some new medical clinic or something or Tijuana, I don't know, but they're getting their testosterone, and it can have lasting repercussions. You know, for one thing, you're essentially committing to it if you're on it for long enough, because you try to get off of it, your numbers are going to get really low, and you're really going to have symptoms when at the end of the day, they probably never, well, I shouldn't say probably, they didn't need it to begin with, but it can cause problems with infertility and other things. So I guess it's just a warning, like, hey, some people need it, some people benefit it, but if you're getting it, make sure you're getting it appropriately. Make sure you're trying everything natural first, you know, before you kind of commit down that pathway.
You only got one body, man. So it's tough.
Yeah, for sure.
Yeah. Well, it's a pleasure to sit down with you, man, and learn just some of the perspectives and how your mind works, man. Urology is, I didn't realize how many pieces to urology. It's massive.
It's a good field. Yeah. I'm happy.
Yeah. I'm gonna have to talk my older son into that because he's a big video gamer. He'll probably be able to be an excellent urologist with robots and everything. So, what's your social handles that people can reach out to you on or be able to check you out?
I think it's Dr. Dave Loves Golf.
Okay, is it really? Okay, you golfer. Okay.
Well, actually, I think that's TikTok. My daughter, my 13-year-old manages my TikTok account. I love golf, so it's
good stuff. Okay,
videos of me on a golf trip doing something.
Awesome.
But yeah, I think it's EZO Ludlow. So my last name Ludlow. My high school nickname was EZO Ludlow. So EZO Ludlow is I think Instagram.
Okay.
And happy to have people reach out. I've had patients somehow reach out to me sometimes through social media.
They probably see you more
and stuff. Yeah.
You'll be surprised how many people can connect with you on social media. It's amazing. So
but we're Las Vegas Urology, and we have a clinic. Just me and my good friend Craig Hunter, and we have nurse practitioner Jonathan Higginson, and we're just over there by Mountain View Hospital.
Awesome.
Yeah.
Well, absolute pleasure to sit down with you, Dr. Ludlow. It's a pleasure. Learned a lot, and check us out at thevegascircle.com, man. So appreciate your time, man. That was great. Yeah.
No, thanks for having me.